What if there was a single treatment that could be the answer to curing even the most complex of genetic diseases? The key to such amazing advancements in modern medicine lies in the groundbreaking technique called gene therapy. With this technique, even incurable genetic diseases such as X-linked retinitis pigmentosa may no longer be a life sentence for vision loss. Follow along as we explore the eye-opening future of medicine. Welcome to the genetic basis of stuff and things. This is Sarah, and she has normal vision. She has the functions of a normal eye. When Sarah looks at an apple, the light reflects off the apple and enters her cornea, which bends the light to help the eye focus. This light passes through her pupils and then the lens to focus the light on the back of the eye. In other words, the retina. Next, it's converted into electrical signals as it travels through a layer of ocular cells in the retina, eventually reaching the rod and cone photoreceptor cells, which are mainly responsible for detection of light and color. Once the signal reaches these cells, it can travel to Sarah's ocular nerve, which carries the signal to her brain, forming the image of an apple. So, what happens when you have X-linked retinitis pigmentosa, or in other words, XLRP? This is Sarah's brother Mark. He inherited this genetic disease when the mutated gene on his X chromosome was passed to him from their mother. The most common gene mutation occurs in the retinitis pigmentosa GTPase regulator gene, or the RPGR gene for short. These mutations are found on the RPGR exons 1 to 14 and open reading frame 15, interfering with the transcript that is necessary for normal retinal function. Such mutations differ from patient to patient and can include alternative splicing, indels, missense, or nonsense codon mutations. These mutations resulted in the rapid degeneration of Mark's rod cone photoreceptors, leading to progressive sight loss. Currently, there are no cures to treat Mark, but worry not, there is still hope. Thanks to major advancements in the use of gene therapy, it may soon be possible to treat this disease. In 2020, a group of scientists led the first phase of gene therapy trials in humans with XLRP caused by mutations in the RPGR gene. Their goal was to rescue the remaining cells in patients with XLRP before complete degeneration. This was considered a safety trial, so participants already had advanced retinal degeneration. These patients were observed for side effects over a 6-month period. First, they used experience from previous animal model studies to perform codon optimization for the RPGR gene sequence. The open reading frame 15 on the RPGR gene is a hotspot for mutation due to its inherent instability, attributed to the repetitive purine-rich region and its ability to undergo alternative splicing. Therefore, they refined this sequence to improve stability, remove obscure splice sites, and increase expression of transgenes. Finally, they use carriers called adeno-associated viral vectors for its transduction characteristics and its clinical safety for primate use. The vector containing the new optimized gene was called the AAV8 co-RPGR and allowed for the new gene to be transferred into patients safely to rescue surviving cells. 18 male patients aged from 22 to 50 with RPGR mutation variants were divided into 6 groups and given different concentrations of AAV8 co-RPGR. After injection of the vector, the patient's conditions were observed over 6 months. Patients in groups 1 and 2 had no obvious improvements in visual function, likely due to advanced retinal degeneration and low concentration of treatment given. All 3 patients from group 3 who received a medium concentration of vectors showed reversal of visual field loss with no major side effects. And finally, in the last groups 4 to 6, there were signs of inflammation after receiving higher vector concentrations. However, this was resolved by 6 months post-op with the use of corticosteroids. Overall, 7 out of the 18 patients were shown to have sustained visual gains during the 6-month period. Gene therapy using the AAV8 co-RPGR vector did not have any dose-limiting toxicities, and reversal in visual field loss indicated the possible regeneration of surviving ocular cells. This trial mainly aimed to observe the use of such vectors on humans, which had not been done before. Although it is likely this treatment will not be used clinically until it has been refined, the trial pioneered the use of this type of gene therapy in a phase 2 trial. The fact that science now allows for the use of such amazing technology on humans is still a big step towards curing complex genetic diseases. So don't worry, Mark. The day where a cure for XLRP is created is surely in sight.